What's up guys, Dr. True here, back on the channel. Thanks for watching this video. If you haven't already, make sure you hit that like and subscribe button. I know all you guys are watching these videos because we got a couple of videos about 30 to 40,000 views. However, we don't have that many subscribers, so helps us out if you subscribe, really appreciate it. Anyways, I'm here with Camille today. You guys have seen her on the channel, but we're gonna go more of an in-depth kind of review and kind of go through everything that we do with Camille. First off, just want to thank her for being a participant and going through a video. But first question that we get asked her on YouTube all the time is, how do people find Dr. Drew? How do people find Hawkeye Chiropractic? So just tell viewers how you found us, why you seek chiropractic care, again, what makes us different or what compared to other offices when you were seeking chiropractic care.
Yeah, definitely. I found Hawkeye through Google. I was doing a lot of research trying to figure out where I might fit best, what the vibe I was kind of looking for was. And I like Hawkeye because it feels very like personal. It doesn't feel like you're just like a number that's like going through. So I was seeking chiropractic care because at the time I was working an office job and I had a lot of lower back pain, as well as I'm in the gym. So my lower back and my knees were questionable at the time. And so, you know, I was trying to figure out how to get on top of that. So, yeah.
Yeah, so one of the things you mentioned is that we're super family oriented. So that's one of the values that we value the most here, is that this is a small family practice. So it's not a big corporate office where you're seeing, you know, thousands of people a week as a practitioner. Specifically, we're individualizing, coming up with specific treatment plans based off their needs and taking time to actually sit down and go through those. So whether it's from your first initial consultation, your x-rays, your report of findings, to knowing each patient by their name, communicating with them, and not just being, you know, a physician, but also being a human. Hey, how's your day? You know, can I help you outside of work, or anything that we can do, and not just me, but the entire staff. So we really make sure that everyone feels comfortable, welcome, and kind of go from there. So as far as discomforts right now, what discomforts would you say we're kind of working on? I know originally started with lower back, it's kind of transitioned with jobs and things like that, but what would you say your main focus is right now?
Probably right now, like my right knee, right hamstring is being a problem area.
Yeah. So Camille's a huge worker outer, or whatever you would say in that sense. She basically works out, what I would say, 6 days a week, consistently, never takes a day off. So with that being said, whether it's running, whether it's high interval training, CrossFit, whatever it is, she puts a lot of load on her hips, lower back, hamstrings, things like that. So we're gonna just go through a little bit of a workup. I'm gonna do some soft tissue on her knee, show you guys how we kind of go through that entire process. Again, any questions or concerns, make sure you just leave those in the comments. We'll be more than happy to answer, and we'll kind of go through this. All right, so Camille, you can go ahead, just take your glasses off for me. And then, okay, so first thing that I'm gonna do, which knee is it again, Camille?
The right one.
This right knee here. Yep. So she's expressed to me today that she's having some hamstring tightness, as well as IT band tightness, probably as well as in her calf. You've been doing a lot of running, or what's the cause of it, you think?
Yeah, and also probably squatting.
Squatting? How much weight would you say you're squatting?
Leg pressing in the 300, like 340 area.
Nice, crushing it. What's your PR?
360.
There we go.
Yeah.
You training for anything? You just...
No, just for me.
Mental health? And
yeah, exactly.
Good. How's your hydration?
You know, not as good as it should be, but
yeah.
trying to work on it.
So guys, what we're doing right now is just warming up this tissue. This hypervolt is similar to if you were to like use a foam roller or a muscle massage stick, or even like a lacrosse ball, but it's kind of tough to get deep into these hamstrings. It's deep muscle, so it's a lot easier for somebody like myself or a partner. You can do like a partner foam roll to just kind of help you out with that. Just warm it up nice and easily. Once you feel like a little bump or a hill, a little bit of scar tissue or knotting, try to focus on that point. Let go, roll off it, come back. How's that pressure, Camille?
Good.
And then we'll go through getting your knee adjusted too. Kind of testing it too. So first thing, I'm just gonna bridge the joint here. Essentially just take a look. So just try to relax that knee. And what I'm doing here is I'm just essentially seeing how much joint play we have, and what we always want to do is compare it to the other side. By doing this, you're going to see, okay, this normal, or the one that she's feeling is normal here as well. I can feel a little bit of tissue here on this IT band. So what I'm going to do, just nice and easy, I'm going to essentially pin that tissue, push down. Some people will call this ART, or active release treatment. You guys can YouTube those other videos on that. How's that pressure?
Good.
So what I'm doing is just nice and easy. Good. Let me know if that pressure is too much. Just loosening up those hamstrings, slow and steady. So I'm working from laterally to medially, nice and easy. That pressure's still okay? Mm-hmm. Yeah. A lot of times, guys, when we're working out and you're having pain while you're squatting, it's typically because of super tight IT bands or these hamstrings. So I typically recommend, especially me personally, if I am having knee pain during a lift, I'll hit a foam roller in between sets just to kind of, one, stretch out that tissue, and two, as you guys know, when you get like a pump, whether it's in your biceps or legs, it gets heavy. So you just want to keep that blood flow, keep that tissue, keep that range of motion. Last thing we want to do is be super tight, all of a sudden drop weight, cause us to have another injury, things like that. How's the calf feel?
Pretty good.
How many times did you say you're foam rolling?
Not enough.
Not enough, I was gonna say. Okay, all right, we're gonna go ahead and adjust this knee. So what I'm gonna do, place my hand here in the joint, just flip it over nice and easy. I'm gonna have her just relax. Not gonna hear a big pop and you're cracking, guys. It's gonna be a little bit of a pop here. Good, relax. Perfect, nice little joint there. All right, so what I want you to do when you leave here, especially, have a partner foam roll the back here as well as these IT bands, and make sure you do it in between sets, okay? Yep. Next thing we're gonna do is just slowly work through the entire pelvis. So first thing I'm gonna do is check her legs. I'm gonna see exactly if they're level or balanced. So what you guys are gonna notice here, when I flex these feet, you're gonna see that she's got a right foot that's a little bit smaller, shorter, as they can say. As well, what you're gonna notice is on her shoes, this rubbing. So take a look at your shoes when you take them off. See if there's any type of rubbing or any type of difference between the left and the right sole. That'll also tell you that you have a hip imbalance. Good, good, relax. I'll lift these legs up. And then what you're gonna see is that this right leg went longer. So what it's gonna tell me is that the pelvis is shifted up and rotated. And one way we're gonna essentially check that just by touching the top of her hip. So top of your right, top of your left, which one's higher?
That one.
Exactly, that right one. Which means that that right hip shifted up. That's gonna drive that leg looking shorter. And essentially, we're gonna fix that right now, okay? So first thing, this piece is gonna pop up just like this. I'm gonna drive that hip down, push back into it. Good, big stretch, deep breath. All the way out. Good, other side, deep breath. All the way out, good. Okay. Let's go ahead and work through the thoracic spine, and we'll get back in that pelvis. So deep breath in, we're gonna adjust these subluxations, misalignments. Good, all the way out. Perfect, good. Go ahead and just relax your shoulder. Good, same thing. Good. How you doing?
Good.
Good. All right, so we want to adjust this right hip. So what I'm gonna have her do, she's gonna lay on her left side, left arm underneath her left ear on this paper. Good. What would you say is your favorite lift? It's gotta be squatting.
It's gotta be.
Yeah?
Yeah.
Okay, so we're gonna adjust this hip and the lower back here. So what I'm gonna do is I'm gonna find what we call our SI joint, sacroiliac joint. Take my palm, okay, my left hand here. Nice and easy, just roll on it. I'm gonna roll her here. Go ahead, just relax for me. Perfect, beautiful adjustment. Okay, we're gonna flip the opposite side. Double check. I'm gonna check the lumbar spine here. Same thing. I'm gonna start from our SI joint here, work my way up. Nice and easy. Good. Just roll. Already going. Perfect. Beautiful. Good. Come on up. All right, so let's just review that. A couple things we did. Okay, first is we always want to warm up that tissue, especially in those hamstrings and the knees. So a couple things I want you to do when you leave here. One, hit that foam roller, cylinder foam roller on the IT bands. Two, take one of those sticks and have a partner kind of foam roll, especially the calves and the hamstrings. And then three, just simple stretch on your back. Take a towel or a band, pull the hamstring nice and tight. And then again, just keeping that pelvis nice and loose. So in between sets, guys, just remember, make sure you have a foam roll, make sure you're stretching, because again, we don't want you to blow your back out or have some sort of a knee give out or anything like that. Okay, again, thank you for being on the channel. Hit us up in the comments. See you in the next video.